Millions of people in the world are living with an intravascular prosthesis, or stent, most of them having suffered from some form of coronary heart disease. In Western Europe alone, approximately 1.5 million stents are implanted per year. This undoubtedly saves lives. However, between 5 and 20% of patients experience a gradual reclogging of the stent, or restenosis, over the 5 following years. Besides the dramatic effects on patients, restenosis imposes a huge burden on our healthcare system in the form of time-consuming diagnostic measures and expensive interventions. The costs for such follow-up treatments amount to about 550 million euros per year in Western Europe alone. With our precise and easy-to-use diagnostic system, patients will be able to detect for themselves, reliably, simply, and immediately any signs of restenosis, and thus reduce costs for follow-up treatments by more than 50%. An idea born at Fraunhofer IPA in Stuttgart 2010 and further developed at the Life Science Incubator in Bonn, where we are working intensively to reach our goal.
The VesselSens solution is based on a sensor system which is implanted together with the stent. The system is wirelessly coupled with an extracorporeal readout unit which allows to measure the pulse wave velocity in the impacted vessel segment.
The sensor system is purely passive. That means it needs no batteries, so there can be no harm to a patient, and the measurement is always reliable. This brings us well the advantage that VesselSens is subject to lower regulatory approval demands. But our vision is much greater. The innovative technology of VesselSens has the potential to be extended to a wide range of applications. It will be possible to monitor blood pressure almost everywhere in the arterial system wirelessly.
The encrypted results of the measurement are forwarded to a cloud service where the data is hosted and only authorized persons have access, like patients, clinicians, or doctors. The measured pulse wave velocity is compared to the first measurement taken immediately after implantation of the VesselSens sensor system, the so-called basic measurement. Correlating these two figures, the degree of vessel narrowing can be derived. The result of this algorithmic calculation is sent to the patient's or doctor's device, which might be a smartphone. A traffic light system will display the condition of the vessel.
In addition, the encrypted data are stored in the database so that the patient or doctor has the opportunity to long-term surveillance. In the interest of medical progress, all patient data are completely anonymized before being stored on the server, making it possible to derive trends and detect further important parameters in relation to restenosis.
Since the introduction of stents in the late 70s, there were some highlights in the stent development. Drug-eluting stents or bioabsorbable stents are examples for such highlights. But considering the last decade, there were no further hits in the stent market. Even so, the annual global market is about $7 billion and is expanding with an annual growth rate of about 10%. The big drop in stent prices may be due to low technological progress, high pressure of competition and budgetary restriction in hospitals. Here, the innovative VesselSens technology may help the stent manufacturer to value up their products. But not only our new intelligent stent concept offers great possibilities for the medical technology, we want to develop a platform, a cloud to store various health data, which can be accessed everywhere. A young and motivated team represents our expertise.
We